All right, we're live. Good morning, everybody. I'm Jessica Davis with Institute of Clinical Excellence, representing the Performing Arts Division. And again, as I say, I'm extremely honored to be here and be a part of this awesome movement in advancing our profession and part of the ICE faculty. So I want to plug that I'm here with Amber, who is amazing in allowing me to be part of Point Park University and doing these videos and also being my subject for torture as I take her through some of these exercises that we're going to go over today. So I'm going to give it a couple minutes just to let everybody log on. And while I'm sitting here, I just want to remind everybody, don't forget to check out ptonice.com for all the courses that are available. We have some amazing faculty, people who are unbelievably passionate about everything in their field, and they're pursuing excellence, and their mission is just making our profession better. So check out all the courses because they're amazing, and I encourage you to do that. Okay, so as we're waiting here, I'll show where I am, which is pretty cool. I always like to do that. So check out this beautiful studio. This is where they perform. I love this. Okay. All right. So my topic of the day today is the hip. So I wanted to bring that up as a primary interest today because hip pain is relatively common in the dancer. So as I discussed the past couple of times, lower extremity injuries are prevalent in the dance world. And if you look at the literature, lateral ankle sprains are the #1 most common injury that a dancer will encounter. However, if you look at hip injuries, they're prevalent. So I thought it would be good to go over that today. Amber's gonna hold that for me because I'm a little awkward here. Okay, so just a general assessment of the literature. So they found that 23.5% of dance injuries involved hip injuries, and that's different if you look at the general population because the general population has an average of 5.6 injuries for hip. So it's pretty common. That's something that we have to address. And you have to think about, though, when you're working with a dancer, their hip anatomy and what they're putting their hips through is going to be vastly different than in your traditional athlete. So remember, I will probably bring this up each and every time I do these podcasts and Facebook Lives, is you have to remember that most dancers are going to be working in that turnout position. So their hips are going to be externally rotated and they're going to be performing in that world. So that's different than how our anatomy is designed to move. It's designed to move in this direction, not in this direction. So with that, don't forget, when you're working with dancers, still put your PT hat on and always consider differential diagnosis. So if a young dancer comes into you, or a dancer in general comes into you with hip pain, you have to think about all your competing hypotheses. So where could that pain be derived? You have to take a good subjective history. Considering that subjective history, then you have your variable hypotheses. So it could be lumbar referral, it could be intra-articular pathology, it could be muscular, it could be adverse neural tension that is contributing to it. So there's a lot of things that you have to have in the back of your mind that you need to prove and disprove. So once you come up with that, and so what I wanted to go over today is some general things that I find when I work with dancers, but remember that you've got your therapist hat on, you're always considering what you're finding in your dancer. So remember that they put their hips, not only are they in a turnout position, but they're required to do extreme levels of elevation. And not only that, they're holding that for sustained postures. So that's another element. So you have to be prepared to, when you're working with your dancer, have that adequate flexibility, but also strength. And knowing when you're curtailing your treatment, you have to imagine what that dancer is going to be putting through. Okay, so I found an interesting article by Kocher in Journal of Dance Medicine in 2006, and they looked at their dancers. Now, they were looking at professional dancers. So in their dancers, they found 40% of them had hip pain. But what was fascinating about this study was that of those 40% of the dancers that had hip pain, the ones that had labral tears, which was pretty common, absolutely none of those dancers had your typical camera pincer type anatomical variant that we find associated with labral tears. So that goes to thinking, one argument or side of the coin which you would say, well, maybe that's because when you get to that professional level, the dancers who had that underlying hip pathology, perhaps they weren't able to get to that professional level. But that's, again, sort of on a hypothesis. We can't prove or disprove that. But what I like to think about is the fact that what led to that underlying labral tear was some type of muscular imbalance, undue stress and strain. So that's where we as PTs come in, because if we can address those impairments, catch them early when a dancer comes in with acute pain, catch it, address what you can find, because you're going to hopefully prevent the development of a labral tear and then prolong their career. So that's the whole reason that we're doing this, is because if you can catch these things early on and you have that thought process, we can make a difference. So I found that really interesting. So we can address the mechanical and dynamic impairments that we find. So when you're looking at dancers, common things that you will encounter is they're going to, as I talked about with the turnout episode, they're going to find compensatory means of movement to achieve that turnout. So if they don't have that natural turnout, they're going to either have a hyperlordotic spine, they're going to recruit and utilize their hip flexor excessively, or rotate from their lower leg. So when that comes in, what we end up finding is dancers have it's very interesting, but they have a lot of muscular imbalances that you wouldn't expect. You would think that you look at what they're doing and they're just performing and they're looking beautifully aesthetic, and you think this is a very strong individual athlete. But when you isolate specific muscles, they're not strong in those areas. So that's where we have to do cross-training, and we have to consider that. So they often have extremely tight hip flexors because they're using their hip flexors to achieve that elevation. Take that last bit of degrees, they're doing a little bit of internal rotation and recruiting that hip flexor. So that's something, and when you think about where the hip flexor lies anatomically, that's going to apply stress on that labrum. So we have to consider that. They also have a lot of core weakness, which is surprising. But remember, they're getting into that hyperlordosis, so they're not recruiting their abdominals, and so they'll have that abdominal weakness. And then they also will have hip rotation weakness, which we talked about in the one episode when I talked about turnout. So when we're working with hip flexibility, because it's not uncommon to have a dancer come in and say, when I get into my elevation, I'm having hip pain, and I want to be able to get here because I have an audition for the Rockettes, and I need to get this elevation, and I'm having this, and it's stopping me. So if you're getting that, so I wanted to show you just some different manual techniques. Once, of course, you've done your manual examination, you figured out that this is indeed the impairment that you're finding, I wanted to go over some exercises that I like to incorporate to teach you that. Okay, so here's where I'm going to put Amber to work. Ready, Amber? Okay, so I'm going to move this camera so I get a good view of what I'm going to do here. Okay, and I'm going to try and do this, rotate it this way. Okay, now I have to find my, oops, maybe not that way. Okay, there we go. Okay. All right. Thank you, Amber. Okay, so the first thing we're going to do, so this is something that most of you have probably seen, a mobilization with movement of the hip, but it can really make a difference. You just use a belt, and I'm going to go ahead and lay on your back, Amber. So if the dancer's having trouble with, let's say, flexion, so come towards me a little bit, Amber, you can just take a mobilization belt, wrap that around you. And the big thing you want to watch when you do this is you've got to have that pain-free path of movement. So you don't want to incorporate pain. You want to find that magical angle. So you have to get creative. You might have to do a little bit of distraction at the joint. You might have to do a little bit of a lateral glide. So you might even do compression. It will vary from patient to patient. So that's where your aesthetics and your hand placement and your force application becomes critical, and also listening to your patient. Okay. All right. So you'll take your patient up into flexion, and what you're going to do is first implement a lateral glide. So I'm doing that by just getting a little kind of hip extension there, extending my lower back, and then I'm going to take her into flexion. How is that? Okay. So let's say she had pain there. What I could do also is I could play with it with a little bit of a distraction, combine that lateral glide, and get into that motion. And so then you would do do several sequences of that. So that's all fine and well, right? That's passive. That helps us get that motion early on, right? The dancer is going to be happy with that, but she's also not going to be happy with that because she's going to want to apply it functionally. You have to apply this functionally. So what I will do, come on up, Amber, is I like to do this in standing because they're going to want to do this in standing. And she came and told me, I can't do a développé because I get hip pain. So how am I going to teach you how to do a développé? So when I did that manual technique, I found with her, if I did a little bit of a lateral glide, I got that distraction, opening up that hip joint, she was able to achieve that elevation. So Amber, what we're gonna do, we're gonna use the TheraBand, okay? What I'm gonna have you do, so I tell the dancer, take this TheraBand, just a thick TheraBand, a black TheraBand, something that you can come up with, and I want you to get like a force like this, okay? All right? And then what you're gonna do is just do, I'm gonna have you just come up and do your développé, okay? All right. Yes, you can do your left leg, absolutely. And I'm going to grab this so that you guys can get a better view of what she's doing. Turn that on here. So she's going to have to play with it, and it requires a little patience. So you want to get that way, 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 way up in your hip. Perfect. Okay, and I would put this arm a little bit closer so you don't have to work so hard. Yeah, perfect. And you can play. So she can play with this angle. Look, she can go laterally. She can bring it up a little bit. She could bring it forward a little bit. She can bring it back. So she can play with that. So your idea is to find that magic force that enables you to get into that développé without having your hip pain. Go for it. So she's coming up. Yep, so see how she altered that? She kind of instinctively knows. And I would also advise, get that belt up a little bit higher into the hip socket. So you'll have to educate, which is fine. Go for it. Good. Do it. Good. How does that feel? Good. Right. Go ahead and go front. Yeah. Perfect. So they often like this because it enables them to do exactly what they came for, right? They want to be able to do that. So that's what you want to do. You've got to get creative when you're working with your dancers, as with anybody, right? Okay, so that's one of my favorite things. Now you can also adjust that and work and teach them, you know, you can play with the angles, you can play with the force, you can play with the direction, and whatever functional task they're having trouble, okay? Typically it's to the front and to the side. It's not often in arabesque that they're having the issue. Okay, you doing all right? I'm giving her a workout already. Okay, so another thing, dancers have that restricted hip flexor, and so they also lack at times when you're checking their hips, you might feel that they're lacking a bit of an anterior glide in an externally rotated position. So I want to show you this. Okay, so Amber, what I'm going to have you do, you're going to lay on your stomach. And I want you to get into a passe. So I'm going to reverse so you guys can see what I'm doing here. Oh, darn it, I'm not good at this. Okay, here we go. Okay. Oh. Okay, so she's in a prone, externally rotated position. Okay, so basically she's in her passe, which she likes to be in. But she told me earlier, hypothetically, she's a patient of mine. She told me when I get into passe, I have a little bit of hip pain. So I'm going to put her into that position. Now I can play with this angle. So maybe I don't get her all the way up to 90. I can bring her down more into a coupe position, or I can bring her up. So you can play with that. Now, hand position is critical. You want to be right over that joint, kind of hand over hand like this. And you also want to watch your body mechanics, okay? So that you can live and breathe and work for a long time as a PT. You don't want to be using a lot of your arms. Make sure you're using your body, being aware of your core. Okay, so I'm going to go in and I'm just, how you doing there, Amber? Okay, so what I can do, just do an anterior glide this way. But again, similar to when we were doing that mobilization with movement, I could come up and I can change my angle. And I can come up in this direction, right? Or I can come over here. So it's really where you find that interarticular play that you're looking for. You're listening to what your dancer's telling you, and you're also listening to what your hands are telling you. Where you feel that resistance, you're asking your dancer, is that what you feel? If they say yes, you can hang out and see if that makes it better. Of course, if they say, you know what, I'm feeling worse in this position, respect that. You don't want to make them worse. So then, let's say, so I got a little mobility, I'm happy with that, but I'm also unhappy with that because I didn't train anything right now. This again was just a passive movement. I want to incorporate function. So I want her now to develop strength in the mobility that I've gained in this position. So now what I'm going to have you do, Amber, I really want you to find your center. So I'm going to have her incorporate her abdominals because, as I talked about earlier, a dancer, when they're trying to get that external rotation of their hip, they're going to often get a lot of lumbar lordosis, so I correct that immediately. Whatever you do, do not let this go. Keep that abdominals working, okay? Remember that little cue where I gave you to kind of think of that lumbar spine coming up towards my hand? Keep that there. Now what I'm going to have you do, I'm going to come up and I'm going to bring this camera closer so you guys can see what I'm doing here. Okay. Flip this around. All right, so she's in passe. So again, the cue I gave her, think of that lumbar spine coming up into my hand. Good. So she's avoiding that lumbar lordosis. She's not getting it. Now what I'm going to have you do here, Amber, I want you to keep your foot in contact with the table, but I want you to try to lift this knee so you're doing a passe. Go ahead, go for it. Very good. And it's quite hard, isn't it? Yeah. Go ahead and do it. So you're going to watch. So she's kind of struggling here. So she's wanting to arch that back so much, and you try to keep this ASIS on the ground. They won't go very high, and dancers don't like that because they're used to having a lot of movement. So it's frustrating for them when you really isolate it. But that's what we're after. Okay, good. That's my timer, but I'm also going to ignore it for 1 moment so I can teach you guys something else. Okay, so that's rotation, which is awesome. We love that. But we also, at times, are going to find that dancers are going to lack that hip flexor mobility. They're lacking that hip extension. So what's a way that we do hip flexor stretching is the Thomas position. Okay, so I'm going to review that Thomas stretch, and then I'm going to show you something else. So Thomas position, what I'm going to have you do, Amber, is I want you to get on the table here, bring your knee up to your chest, okay? Awesome, and I want you to scooch, 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 almost like you're going to fall off the table. Perfect. Okay, so I'm here. Actually, can we reverse for just a moment so that they can see? Okay, so I'm here, and I'm making sure that she doesn't get lumbar flexion or extension, right? So I'm kind of locking her down there, and then she's getting into that Thomas position, and we can do a hip flexor stretch. That's fabulous, right? We're happy here. However, again, we want to incorporate some strength, right? So what we're going to do here is I'm going to have Amber, I'm putting my hand underneath her knee, and I want you to push down into the table. Drive that leg down. Go, 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 go. You okay? Again, she doesn't like it because I'm at that end range and she's weak there. That's okay though, it's something we can work on. Okay, so I would resist her here several times. Perfect, okay? So this is great, this is lovely, this is fantastic, this is something that we can do. Now what am I going to teach her to do at home? What's something that she could do to work on this? So another thing you can do, she could just do that on her own and just work on resisting down, or have a friend kind of give you some resistance. But I also am going to have you do, you're going to lay on the table. I'm going to bring the camera over here so you guys can see this. So she gets into this lumbar flexion position. This is great because, again, remember, your dancer's going to want to extend their back, right? So this, they can't extend. So now what I'm going to have you do, Amber, here, I want you to lift that leg. Good. And down. And up. And down. Fantastic. So that's a way that she can work on strengthening and hip extension, but she's not getting her typical lumbar extension type pattern. So all of these are little tips, but you remember, you're finding your impairments, you're finding your weakness, and you're identifying what you want to work with your dancer, and get creative. One very final thing I want to show you, splits. So some dancers will tell you, I get hip pain when I do my split. So now that Amber's warmed up, I saved this for last because I figured she needed to warm up. Okay, so what we're going to do, we're going to use that TheraBand again. So Amber, remember how I showed you to put that belt around your hip? Okay, so let's say she gets left, is it left hip that we're going to work? Right hip. Okay, so couldn't go around that right. Okay. So she told me, you know what, I get right hip pain when I'm doing my right split. So So what I've taught her is I want you to find that magic angle with the belt, pull that and get into your split position. And so what you can do, you tell the dancer, fiddle with it. And they're really good, as I've said, they've got that aesthetic awareness, they understand their bodies. So you just kind of work on fiddling with that angle. How you doing with that? Good. Good, okay. All right. So I want to thank everybody for listening to me today. I hope you learned something, and you can apply it hopefully in the clinic today when you get a dancer that's going to come in. I want to remind all of you that I'm teaching a course in Chicago, January 20th and 21st at Lincoln Park at Entropy Physio. So thank you to Entropy Physio for allowing me to do this course. Also, you can follow me on Instagram at J_Davis7476. That's my Instagram thing. And take a look and listen to Christina. She's going to be presenting tomorrow on the aging adult. She's fabulous. So listen to her. She's wonderful. I wanted to say that. And don't forget ptonice.com and pay attention to all our wonderful courses. Thank you for coming today or listening to me. All right. Thanks.